This is Module 3 of your Emergency Medicine Orientation podcast. First, I'd like to mention that when a student or visiting resident arrives in the emergency department, that they be on time during his or her scheduled hours, unless the shift coincides with any didactic session, including grand rounds, journal club, simulator rounds, or any labs. Please arrive early, at least 10 minutes before the start of your shift. If a student or visiting resident must leave during a portion of a scheduled shift because it overlaps with required conferences or other reasons, it is that student or visiting resident's responsibility to notify the attending physician and make an appropriate disposition of his or her patients before leaving the department. The individual students and visiting resident schedules will be given to them ahead of time. I'd like to first go over patient care responsibilities. When a student or visiting resident arrives in the department, they should be dressed appropriately. Please wear your name tags. Please introduce yourself to any patient he or she attends, as well as all nursing staff, administrative partners, and physicians. I would like students and visiting residents to please act and dress in a professional manner, to please wear your lab coat at all times. It is okay to wear scrubs, but they must be the color blue. It's really the main responsibility of each student and visiting resident to evaluate patients who present themselves to the emergency department and discuss these patients with the appropriate supervising physician. Again, with the exception of immediately life-saving procedures like CPR, all planned procedures and lab X-ray studies shall be discussed with the appropriate supervising physician prior to ordering them or discussing them with the patient. It is important not to set expectations for the patient that cannot be delivered. For example, telling a patient that they will be admitted when the attending had no intention of admitting that patient. It is important that you review these things with your attending and or supervising physician before proceeding. Student or visiting resident rotating the ED is encouraged to participate in all medical and trauma resuscitations. He or she may participate in any trauma resuscitation if the ED is not busy and has permission from the emergency and trauma attendings. Just introduce yourself to the appropriate attending, and most likely you will be included. There are 3 levels of trauma resuscitation. Trauma ED, which is basically trauma light. Patients will be seen in the main ED. These are generally falls in elderly patients, or let's say a child who falls off a bike, who may have had loss of consciousness, but who is stable, or a pregnant patient who may have been in a low-speed car accident and has no signs of injury. There's a trauma alert and a code red triage. And these patients are mainly seen in the trauma bay or in the trauma bay OR or by the trauma team. A code red patient is someone who has penetrating trauma either in the chest or abdomen and requires control of that bleeding, typically in the trauma bay OR. The criteria for trauma alert and code red are posted outside the trauma suite. Students shall immediately notify the ED attending of any unstable patient in the ED. This team approach to the critically ill patient will ensure better care for the patient, more rapid evaluation and stabilization, and more rapid referral, if necessary, for definitive care. It's important that you communicate with your supervising physicians. Don't be a cowboy or a cowgirl. Lastly, no patient physically in the ED will be without an assigned physician during their stay. Students and visiting residents shall turn over their patients to another student, if it's a student, or if it's a visiting resident, you try to sign it out to another resident at your same year level. or the appropriate supervising physician at the end of the shift. All of your documentation will be completed prior to leaving the department, and that's for both students and visiting residents. This also applies to any other time a student may be leaving the department prior to the end of his or her shift. Please notify the attending or supervising physician any time you leave the department. It's very important to keep us informed where you are, where you're going, and how long you'll be gone. Let's talk about documentation. Students are responsible for documenting the important historical and physical findings on the ED chart, and this will be done on the paper T-chart. These charts have various templates that will correspond to a particular complaint. For example, vaginal bleeding in an obstetrical patient, or fever, or lower extremity pain or injury, or head injury. Remember to choose the appropriate template for the presenting complaint. We want you to complete the medical decision portion at the end and generate an expanded differential diagnosis, preferably 5 or more items on your differential, in order for us to evaluate your thought process. Please document the date and the MR number of your patient on the chart. Please sign the chart as well as your attending physician. I would also like for you to explain why you arrived at a particular diagnosis in the course section of your T-chart. We want you to have the supervising physician, senior resident, or PA review your documentation and sign it. Please keep all of your charts and submit all of them to Donna Bigelow in the 5th floor residency office by the end of your rotation. If you worked 14 shifts, we would expect you to submit 14 charts. Remember, this is not part of the permanent record. Ideally, in the future, we would like to have an electronic student T-chart so that you may document directly on the electronic T system. Currently, this time, it's not available. For visiting residents, you will continue documenting in the electronic medical record for T system. Hopefully, by the end of the month, you will become at least competent and even proficient in using the T system. Now, seeing a patient from start to finish. Let's cover that. Remember, the ED is divided into pods. There's 4 at Cedar Crest, 2 at Muhlenberg, and you have Express Care at Cedar Crest, as well as an RAU at Muhlenberg. So each pod is staffed by an ED physician, resident or residents, and nurses. Students should work in their assigned pod for the duration of the shift. You will be assigned to a specific pod, and that goes for visiting residents as well. Ideally, we do not want you to spend more than 15 to 20 minutes performing a history and exam on your patients. Occasionally, a supervising physician may observe the student or resident taking his or her history and exam, sort of a direct observation. Students can obtain the nursing triage notes by accessing the appropriate T-system template. They will present their patient to an attending physician, senior resident, or a PA. Then the supervising physician and student will see the patient together. Hopefully, you will discuss the differential diagnosis and management of the patient outside the room. Occasionally, this discussion may occur in front of the patient, which is fine. The student will return to the patient's room and discuss the plan. It is the student's responsibility, or a visiting resident, to keep the patient informed of their test results or any unforeseen delays. The computerized discharge instructions must be given to all patients being discharged and are to be reviewed with the supervising physician prior to final disposition of the patient. A copy can be printed from the appropriate T-system template. A nurse or physician must co-sign your discharge instructions if you're a student. If you're a visiting resident, they do not need a co-signature. It's important that we provide you with a independent learning experience. We do not want to be a helicopter attending. We want you to get a reasonable amount of autonomy and that you make your own decisions with your patients. For example, if you want to order a series of blood tests, even if the attending physician may disagree with that plan, I think it's reasonable to allow the student or visiting resident to get those tests, because I think in the end, it will be a learning experience for that student or resident. Perhaps they need to see those normal values 5, 6, or 10 times before they then decide that they may not need to get those tests in the future. That is the process. Now let's talk about procedures. Procedures in the emergency department are to be directly supervised by the appropriate individual, and it really depends on the procedure being performed. For example, nursing may supervise placement of NG tubes, Foley catheters, IVs, and blood draws. Laceration repairs may be supervised by an attending physician, a PA, or senior resident. All laceration repairs occurring in express care should be inspected by the appropriate attending physician before and after the repair. Remember that we cannot bill for any procedures performed unless we are involved in that procedure. Lumbar punctures, central line and chest tube placements, and any orthopedic manipulation should be supervised by the senior emergency medicine resident and or attending physician. When it comes to airway management and procedural sedation and analgesia, this should always be under the supervision of an attending physician. Please do not attempt to do these procedures with just a senior resident when we're involving the airway or potential compromise of the airway. When in doubt, just always consult the attending physician. Remember, don't forget to document all your procedures in the procedure log in New Innovations, which is called Procedure Logger. This will be explained in another module. Now I'd like to briefly discuss dress and conduct. You should wear a clean and pressed white lab coat at all times. Scrubs are acceptable, but they must always be worn with your lab coat. It is important that you wear socks or hose over your feet and wear shoes that cover your toes. Surgical clogs are acceptable if clean. Flip-flops are unacceptable. Please wear your identification badges at all times. Again, all male students will wear a shirt and tie with slacks unless you choose to wear blue scrubs. All female students will wear appropriate professional attire. Matching blue scrubs are acceptable if clean. It's important that you treat all patients and families and ED staff with courtesy and respect. This is important and paramount. Patients and families can hear what you say no matter where you are in the ED or outside the ED. Remember, keep all inappropriate comments or joking to yourself. It will eventually get back to me and our chairman. Eating and drinking in patient treatment areas is prohibited. Please abide by this. You may use the staff lounge, for eating. You are always excused for lunch and dinner for 30 minutes. Please put all your personal belongings and books in the staff lounges at each site. Complaints regarding unprofessional behavior of any student or visiting resident should be brought to the attention of myself or Dr. Gerald. Unprofessional behavior from a student or visiting resident could be grounds for dismissal and or failing the rotation, depending on how egregious the behavior. This has happened before, so it's important that you be aware of this. Please refer to the Press-Ganey tips in the appendix on improving your interactions with patients and their families. It is important that you help the nurses, whether it's starting an IV, moving a patient, placing an NG tube, drawing labs, or whatever. If a nurse asks you to do something, just do it. By helping them, you help yourself. Now I'd like to talk about work absence. The student must notify the Office of the Emergency Medicine Residency of any absence due to illness, family crisis, or any other problem that arises. The student must also speak directly with the ED attending prior to missing any shift, as well as myself and Dr. Gerald. Students who miss a shift must make up their shifts, even if it is at the end of the rotation. It is important that you get the 14 shifts completed prior to the end of the month. We have had students return from their schools to complete shifts that were missed. There are no exceptions to this rule. So, barring any extraordinary circumstances, it is expected that any shifts missed must be made up. Now, with regard to visiting residents, they have contracts which provide sick leave or sick time. So, visiting residents who missed shifts are not required to make up those shifts if they're due to illness. However, if they take a significant amount of time from the rotation, we will have to deal with this on a case-by-case basis. Next, we will cover new innovations in the next module.